Good evening, everyone. We're seeing everyone just joining. We're going to give this one more moment while everyone tunes in. Welcome, welcome. I love seeing familiar names and faces on here. We're really happy to have you this evening. My name is Rachel Lieberman. I am a director here at the Celiac Disease Center. We are so pleased to have you this evening. I am joined by my colleagues, Lindsay Yakel, who is our educational coordinator, as well as Dr. Ritu Verma, who you guys are all here to talk to this evening. And tonight, we really want this to be an interactive format. We have a Q&A function at the bottom of your screen of your Zoom box. We encourage you to please put questions in the Q&A, not in the chat. So if we can adhere to that, it'll make things a lot easier for Lindsay and I as we kind of bounce questions to Dr. Verma. But we want to say tonight is yours. I know a lot of you have questions for Dr. Verma. There's always educational opportunities. Lindsay's going to kick us off this evening, but I please encourage you, and we are recording this session. We will be posting it after tonight on our YouTube, which Lindsay will send out information on how to view that. So you can take notes if you want, but really tonight is about you guys and answering questions and having our incredibly wonderful expert, Dr. Ritu Verma, who is our Chief of Pediatric Gastroenterology here at University of Chicago, as well as our Medical Director at the Celiac Disease Center. But I'm going to turn it over to Lindsay, who can get us started.
Sure. So yes, we're going to do this Q&A style. So we welcome anybody to submit those questions. We have some already. And while we start, go ahead and feel free to add some more in there. First question we have is there a skin version of celiac disease?
So I don't know if we call it a skin version, but there are skin manifestations. So there are skin findings that you can have associated with celiac disease. And classically, I think everyone knows about this condition called Dermatitis Herpetiformis, or DH in short, where you have this really painful, itchy rash. Classically, people talk about this rash being more on like the elbows and things like that, but it can really be anywhere. But when you look at the textbooks or you Google it, you'll find usually a picture of someone with the elbows on there. It's very itchy, very painful. It's seen in some people, and the diagnosis for those people is actually made on a biopsy of the skin. So you need to see a dermatologist. And the dermatologist should be aware that they're looking for celiac disease because there's specific stains that need to be done. And the diagnosis can be truly made on that skin biopsy. And that's a classic known associated rash that is with celiac disease. And the treatment is still the same as far as a gluten-free diet, though there are some people who need to be on a medication as well called dapsone. That is used for dermatitis herpetiformis. It's one of those conditions that if you were to do an endoscopy and a biopsy, your biopsies actually may be normal. So just having normal biopsies does not mean that you don't have celiac disease. So that's why I was saying that you really need to see a dermatologist to make that diagnosis. So an endoscopy is often done, but sometimes it is negative in terms of the small bowel biopsies that are classically seen in the intestinal celiac disease.
Great. Okay, so the next question is, what family members should be tested for celiac disease if I have it?
So if I is a parent, then you have your children tested. It runs in families. And so therefore, if a parent has celiac disease, their children need to be tested while the children are still eating gluten. Let's say it's mom who has celiac disease, then of course, mom needs to let her siblings know, because again, going backwards, so your siblings, your parents, you would need to let them know and they should be tested. But definitely your children regardless of symptoms. And I think it's really important to remember, and sometimes not everyone is aware of it. So they say, well, if I don't have symptoms, I don't need to be tested. But the symptomatology is so different in celiac disease in so many people. But regardless of symptoms, if one person, a parent has, and I'm a pediatric gastroenterologist, so I talk parents. So if a parent has celiac disease, their children, all of them need to be tested. And then not just tested the one time when you are diagnosed, but also periodically over time, they need to be screened so long as they're eating gluten. So first degree relatives, second degree relatives, all need to be tested.
Great. Can you get celiac if you don't have the gene?
So that's a loaded question. Traditionally, if you don't have the DQ2 and DQ8, traditionally it is taught to us, and we've all been told that the chances you will have celiac disease is very minimal. There are new genes that are being found as well. So yes, the quick answer is yes. If you don't have DQ2 and DQ8, the chance you'll have celiac disease is about 3 to 5%. But there are other genes that are being found. There's something called DQ7 that is in certain populations, and that has also been associated with celiac disease. So you could comfortably say, yes, if I don't have those two, most likely I don't have. But if you have symptoms that are not explained by something else, then go down the path of looking at celiac disease. So I think that the knowledge base is increasing. We're getting to know more. And therefore, what we know today may be very different than what we know in another 10 years.
Okay, so we're going back a little bit here in regards to the dermatitis herpetiformis conversation. And are there blood markers with dermatitis herpetiformis, and are there gene markers?
Well, the blood markers, if you mean the antibodies?
That's what the question says. So,
Let's go back even further. Let's go back even further in terms of the diagnosis. So how does one make a diagnosis of celiac disease? The first is you think I might have celiac. So the thought has to come in first. And then the blood test that's done is looking at those antibodies. So I don't know if the person is talking about antibodies as markers, but if someone has celiac disease, majority of people, these antibodies are high or abnormal while you're eating gluten. And the same happens with dermatitis herpetiformis, is those antibodies are elevated. I don't know if that answers the person's question, but if the person is on, go ahead and ask if I haven't answered your question.
Okay, and then there's a question asking how often those periodic screenings should happen that you were referring to for family members.
So, there are no absolute guidelines. We know that you need to get tested. And I'll tell you what I do. So when I am screening, and as I said earlier, I'm a pediatric gastroenterologist. So when I am screening my patients' siblings, I will screen them every year, the siblings, every year till they reach. And then after that, every 2 to 3 symptoms or not. Is it absolute that you have to be screened every year? Not really. But what happens, the reason I pick every year for the children who have not reached puberty is just because the symptoms can be so different and the window of growth. So in children, one of the things we're always concerned about missing celiac is the growth. So if you go beyond puberty, your growth plates and all that fuse, and therefore your height is done. So in my mind, if we screen them every year, you will not miss that window that they may. So to have them achieve full growth is where I do the screening every year. And it's also easy to remember that, every December, everybody gets screened for celiac disease or whatever. Pick a month and it's easy to remember. So the guidelines we know for sure are that the family members need to be screened. How often has not been totally defined. I just use puberty as the cutoff just because height and growth and so on is something that we want to look at.
And Lindsay, before you move on, I wanted to ask Dr. Verma this. I had a conversation yesterday evening at another celiac event, which I see some familiar faces. Some of you joined us. What happens if you have celiac, have a child, have a baby? At what point do you get your child tested for celiac? What are the guide? What do you think?
So I think if a mom has celiac disease and the baby, what we recommend is between 2 and 3 years of age. The baby should get tested. But again, you've got to go back and look at the history in terms of diet. So if sometimes what happens is that if a mom has celiac disease, then you're hesitant in feeding your child gluten. So if you've not introduced gluten till a child is 2 or 2.5, then of course the testing is delayed. But if you're feeding the baby traditionally, then between 2 and 3 years of age. Having said that, what I would say is if you have another child who got diagnosed when that child was 1.5 years of age, then of course your next child, you're going to screen them earlier. But traditionally, we say between 2 and 3 years of age, so long as the child has been eating gluten. I really think it's a very important sort of comment to think about in terms of the amount of gluten. So if the baby or the child is not eating enough gluten and you do the blood test between 2 and 3 and it's normal, I wouldn't sit back and say, oh yeah, life is fine and there's nothing else happening. So always the history of how much gluten is in your diet becomes very important. But between 2 and 3 years of age is where the recommended timing is.
Okay, so the next one is, apparently in the past, Dr. Verma, you've mentioned that children should have endoscopies, biopsies done even if celiac blood test is positive. This person's child's pediatric gastro follows EU standards, and since her daughter's blood test results were over 100, he's not recommending the biopsy endoscopy. Can you please clarify why you still recommend the biopsy endoscopy? Does a child need to be reintroduced to the gluten diet for the biopsy endoscopy?
So there are two different guidelines going around in the world. So one is the North American guidelines, and then there's the European guidelines. So the European guidelines have evolved over time, and in fact, they've changed even over time. And that's the European guidelines that talk about no biopsy. And recently, there were guidelines sent out by the American College of Gastroenterology that also talked about no biopsies. So I'll tell you my rationale and why the North American Society of Pediatric GI has not totally committed to the no biopsy ruling. One is the blood tests that are done here in the United States are not all standardized. So if you look at your celiac antibody testing over years, and if you switch around from LabCorp to Quest to University of Chicago, or you go somewhere else and get labs done, you'll find that each lab is doing a different assay. And the way you know is because the norms are different. So we have not been able to standardize our testing in this country. And so people feel very uncomfortable in saying, if you have an elevated TTG, that's enough to make a diagnosis. So that's one reason. The second is there are children and adults, not just children, but and adults who, when you do an endoscopy, you find that they don't just have celiac disease, they have something else as well. So for example, eosinophilic esophagitis might be there, H. pylori might be there. So there are other conditions, other disease processes that can happen, and you can still have an elevated TTG. And then if there are children who have other autoimmune diseases, so for example, they have type 1 diabetes and they have a elevated TTG, does not always equal changes in their small bowel biopsies, and that is clearly been defined. So you can have an elevated TTG with type 1 diabetes and not have celiac disease. So hence an endoscopy and a biopsy helps you make that diagnosis. Another reason why I recommend a biopsy is for children especially, and I don't know about adults, but children for sure, a teenager is more convinced on staying on a gluten-free diet if they know there's a biopsy that's abnormal rather than just a blood test that would, especially the child who does not have symptoms. If you don't have symptoms and you're just told to go on a gluten-free diet, you've got to convince that person that they need to be on a gluten-free diet. And lastly, what I would say, and probably not the most important reason, but down the line, as we talk about medications coming down the pipeline, right now, the only people who are in those studies for those medications are biopsy proven. Again, that is not the reason to do a biopsy, but again, that's a total picture. I think this discussion needs to happen with everyone. And then it's an individual decision as a family. I can give you my recommendations, but that doesn't mean that you have to follow them. I think at that time, we need to have a dialogue. Why do I think this should be done, or why does another gastroenterologist think differently? And those are the discussions that one has. And I have patients where they'll say, I would not want a biopsy. And we have a full discussion of the pros and cons of having a biopsy versus non-biopsy. But that's really where North America has not totally adopted the European guidelines.
Right. We do have two other questions here that are sort of on the same thought process. One is, as you were talking about that, somebody asked, is there an advantage to have an endoscopy if you are pretty sure the child has celiac? You probably sort of answered that.
Yeah, I mean, I think that it has to be a discussion with the family and the physician. It should be a joint decision. And I don't think there's anything wrong if a parent tells me, I heard you, but I still don't want a biopsy. That's fine. But that's a dialogue that we need to have. No parent or person should feel 5 years down the line that, oh my God, you did not explain all the reasons for it. And I wish you had explained all this to me and I would have made my own decision. So I don't force anyone that they have to have a biopsy. I sort of give you these reasons that I just gave, and then it's a joint decision. The end result should be whatever, whether you do a biopsy or not a biopsy, you got to stick to that diet. And I think that we all know ourselves. Some people will say, you know what, I as an adult will stick to the diet better if I know that I have damage to the lining of your small intestine. So I'll go for a biopsy. Another person might say, I don't want to do an endoscopy and I just want to go and I'm convinced that I have celiac disease. So long as both the groups follow the treatment, nothing wrong with that. And then I think what's important to remember is that if you don't have a biopsy done and your symptoms are not improving, then you've got to think, do I have something else or not? Is there some other associated condition that's going along? And then you go down that path.
Okay, so still on the same thought process, we have somebody who has twin boys who were diagnosed with celiac when they were very young by endoscopy. They're now almost 12 and they're questioning things a bit because they aren't feeling any effects when they're ingesting. So based on the conversation that you just have had with everybody, there's a sort of a follow-up to this is there something that they can do now at this point in the kids' lives to a blood test or another endoscopy or something to kind of reiterate that they need to stay on the gluten-free diet, that the kids are questioning it and maybe doing a little bit of loosening up of the diet and that kind of thing.
So let me understand the question. I think I lost you somewhere. So
Fine.
these children, the twins, did they have an endoscopy at
They
the time?
did when they were very young.
Okay, so that endoscopy confirmed celiac?
Yes,
So the children are questioning because they don't have symptoms.
correct.
I think then the children need to be educated. I think there's a lack of education here because not everyone who has celiac disease has symptoms. So if a child has had, a person has had an endoscopy that confirmed the diagnosis for sure of celiac disease, and now the children are eating gluten and not having symptoms, is that what I'm getting at?
It sounds like when they get some gluten in them, there's no symptoms. So they're maybe questioning a bit
So I think there is two paths here. One is it's very important for those children to have an education, not just from their parents. You know, I have children as well, and they'll listen to their doctor, they won't listen to me. And so therefore, I think it's important to have the clinical team sit and discuss with these children to explain to them, just because you're eating some gluten and not having symptoms doesn't mean you don't have celiac disease, right? So I think that that education piece needs to happen. Now, if the children want to be convinced again that they have celiac disease, then unfortunately they'll have to go through a challenge. And I usually will say, I'll have a one-on-one discussion with the kids and ask them honestly, you know what? If you are having gluten here and there every week a little bit, I would rather you tell me that, and then let's do a formal challenge. Let's challenge you with gluten and get the blood work done, and then maybe another endoscopy, and will that convince you? I would rather have an open discussion with them and agree with them that it's not always easy to stick to a gluten-free diet, especially if you don't have symptoms. So let's talk about it. Let me explain to you what are the long-term complications that can happen if you continue to eat gluten. Because even if you don't have damage, I mean, even if you don't have symptoms, the damage is ongoing. So that would be one approach that I would do first to educate them. I'd first look at those biopsies to be sure that they are truly celiac, and then educate them. And if the children come up and say, you know what, I'm still not convinced, then let's talk about a challenge. So challenge with gluten, do the blood work, do an endoscopy again if need be, and prove it to them one way or the other.
Okay. Next question is there a limit on the amount of school sports a child with celiac can play?
No, there should be none, so long as a child is, or the adult is on a gluten-free diet and is following up with the dietitians to make sure they have enough calcium, their vitamin D levels are low, are fine. They're not, the only time I'd be concerned about not doing sports is if your bone density is down or something like that, or if you're anemic. But the sky's the limit. You could do whatever you want to do if you have celiac disease. It shouldn't stop you from anything, so long as you're on a gluten-free diet and eating a healthy, nutritious diet. Nothing, it should not stop you from anything.
And Dr. Verma, I just want to bridge back to our twins, our
Yes.
case study, our twins. Someone is just looking for clarification. You would have to do a gluten challenge, correct? Not just do serology, the blood test, and endoscopy.
So I think that if I have a discussion in confidence with the twins and the twins say, you know what, I really am eating gluten 5 times a week, then I would do the blood work at that time. But if they say I have gluten once every other week or something, then I would tell them, yes, let's challenge. Let's do a good scientific formal challenge, then do the blood work, the serology, and kind of go from there. But I really think those twins need to have a discussion.
So we've got a little follow-up from the twins.
Yes.
The question, I guess, is it a bad idea to loosen up on cross-contact concerns if the twin boys do not have symptoms when they ingest gluten? Is it a
Yes,
bad
I think
idea?
it goes back to the education. Why is it that we have people? I guess my question to everyone would be, does anyone know why you have to be on a gluten-free diet? You're not on a gluten-free diet for belly aches. You're not on a gluten-free diet for diarrhea. You're on a gluten-free diet because you want that intestine to heal and you don't want to have complications, autoimmune complications down the line. So you are not on, I mean, yes, we start off with pain and we get the diagnosis, but the main reason you're on a gluten-free diet is because you want to prevent malabsorption and you want to prevent other autoimmune diseases from happening. So going back to the poor twins, is that if they have the loosening up to cross contact depends on how much is this loosening up. Is it that they're now eating some gluten? Is it that they have cross-contaminated French fries once a month? I think it depends on what loosening means. And then even a bigger question would be, if you tell them that they can loosen up and not worry about that, then what else are we loosening? And that is always the concern when we say you can loosen up your diet. So we know that if you have ingestion of greater than 20 parts per million every day for a month, and it could be just 50 parts per million, there is damage. So that is known. So I'm always worried when we say you can loosen up. In a teenager's mind, what's a loosening up? Even in an adult, people who say, okay, I want to cut down on my desserts. Do you say to yourself, I'll have dessert once a month? Or do you feel that craving every week? We all know each other, we know ourselves, and we know others in terms of what would be. So should one loosen up cross-contamination? It depends on how often someone is going to do it and how much is that cross-contamination. And that's really the bottom line. You get cross-contaminated once a month, the same fryer, okay. But if it happens every week, and from once a month, it goes to every week to every day, that's going to be a problem.
And Dr. Verma, can we revisit, we talk a lot about, what we're trying to avoid happening with autoimmune disease. If celiac disease is not managed properly, can we go down that road a little bit and talk about what could happen with autoimmune, other conditions that could develop?
Sure. And I think what I really would like people to know is these conditions happen if it is constant exposure to gluten. So it's very important to remember that it will not happen if once in a while somebody has some gluten, it will not happen. But that once in a while, how often becomes the problem. So if your celiac disease is not under control, you're at a higher risk, of course, for iron deficiency anemia, you're higher risk for vitamin deficiencies. But bigger than that, thyroid disease is probably the most common autoimmune disease associated with celiac disease. There's a concern from type 1 diabetes, infertility, different kind of malignancies, bone disease, osteoporosis, osteopenia. So all of those are conditions that are associated in a small way if you have uncontrolled celiac disease. I don't want anyone to go away from this hour thinking, oh my God, I had gluten 2 weeks ago, I'm going to end up with this disease. No, it is uncontrolled celiac disease leads to these down the line. Very important to remember that. One of the things that some people get into that mental frame that if I have gluten, if I go out to eat, I'm at a higher risk. No. If you go out to eat, you can go out and eat safe and you're totally fine. So please do not leave this hour thinking, I had that one French fry, I'm at risk. No. It's repeated exposures and uncontrolled celiac disease leads to these conditions, not once in a while.
Along those same lines, somebody's asking what tests you recommend people with celiac should get regularly, like thyroid tests or any of those things that should just be done regularly.
So follow-up is really important. I think that, unfortunately, sometimes people get diagnosed with celiac disease, biopsy or no biopsy, whichever way you get diagnosed, you might see somebody, your clinical team at time of diagnosis, and then the rest is left up to Google and other things. So very important that follow-up appointments are made. And during the follow-up appointments, what should happen is obviously meeting with the dietitian. Even if you're sticking to a gluten-free diet, it's very important to meet with the dietitian because they're looking at your different vitamins and things like that, fiber, fat, all those things. And then important to follow up with your blood work. So you have to see that your antibodies are improving. So over time, whatever the number of your antibodies was at the time of diagnosis, over time, the numbers should become normal. So that's part of the follow-up blood work. And then as a baseline, everyone should have iron levels done, vitamin zinc, B12, especially in the older child and adults, folate. So those are vitamin levels, thyroid, hemoglobin A1C, that's done baseline. And then you repeat those again if they're abnormal. If they are not abnormal and you're fine, then you do them once a year as you do your celiac panel. So those are sort of the labs that are done. You look at the liver, you look at your vitamin D, zinc, iron, other follow-up labs that are usually done.
And Dr. Verma, just to follow up, and I want to give a shout out to Lori Wellstead, one of our dietitians is on tonight. We're so happy to have her join. But who is ordering these follow-up labs? Is this at your primary care physician, your annual appointment, or is this with your gastroenterologist?
So majority of times it's the gastroenterologist, though there are primary doctors who are very willing to do this. So I think it really depends on who your primary is, who your gastroenterologist is, and so on. I personally think, and it's not because I'm a gastroenterologist, but I think it's important to see a gastroenterologist. And the reason I say that is, your primary doctor has so many things that they have to learn and so many new things that are coming up. And they cannot, one person as a primary doctor cannot keep up with all the nuances of all the diseases that they face when a person sees them. A gastroenterologist has only GI things that they want to keep up to speed on. So I think you should see whoever's the expert in terms of ordering the tests and looking for other things as well, where a primary doctor is not their fault. I mean, they have so much else that they have to keep an eye on. And then to learn what's the new thing in celiac disease is tough. And the other reason I think you should see your gastroenterologist is because then you get to know what's new, what's the new medications on the horizon, what are the drug trials that you can get involved with, what are the other research things that you can get involved with. It's your disease. So therefore, if it's my disease, I want to know everything that is current and I want to know what's on the horizon. And your primary doctor cannot know that. So I just think it's important that it should be your gastroenterologist and someone who can bring you up to speed with the latest of what's going on besides ordering these labs.
Okay, the next question is, can celiac affect joints and tendons, maybe related to inflammation and things like that? And also, do you see any increase in inflammation related to COVID exposure or COVID vaccine?
So I'll answer the second question first. COVID and celiac disease in no way is the vaccine affected. And this was actually an international registry that was there for COVID vaccine and celiac disease patients, and there was no increase of anything. So nothing at all associated COVID vaccine or celiac. Your other question was what?
The first part was, can celiac affect joints and tendons related to maybe inflammation?
Absolutely. So one of the symptoms with celiac disease can be joint pains, leg pains, muscle pain. Sometimes as parents, we tell our children they're having growing pains where they're up the whole night complaining of leg pains. So yes, it can definitely give you joint pains. Usually does not give you swelling, but definitely joint pain is there. There are some children, I actually seen a couple who actually have joint swelling, but I would say you want to look for other things as well with joint swelling, but joint pain, muscle pain, leg pain, yes. Fatigue is one of the very, very common symptoms of celiac disease. And it's one of the symptoms that improves the latest, even when your vitamin deficiencies are corrected. Headaches, behavior issues, depression, anxiety, can all be related to celiac as well.
Okay, we have a 13-year-old that would like to know what the most common symptom you hear about for when somebody gets gluten. This particular person deals with throwing up every 5 minutes for 2 hours. So I think that she's just wondering if she's alone in that or if that's a common symptom.
So, the 13-year-old, thank you so much for this question. I love it. As I said, pediatric gastroenterology, I want the children to ask the questions because you own the disease. You need to learn your disease. So I'll tell you, there are studies done looking through drug trials. So the most common symptom is nausea, even though we may not think so, but the most common symptom when adults were challenged with gluten for these drug trials, nausea was the symptom that came on to be one of the first symptoms that came on is nausea, and one of the most common symptoms. So my dear 13-year-old, I'm sorry you're suffering through this, but nausea, vomiting, more than abdominal pain is the symptom for gluten ingestion in a lot of people with celiac disease. I really feel bad for you, but one of the medications that, if you are listening, one of the medications sometimes that does help is Zofran that you can take for the nausea. If you can get that timing correct, that you take Zofran, and that hopefully will cut down on those multiple episodes of vomiting that you're having. I feel for you. Sorry.
Okay, we have another one that is asking about medications that might be coming out. They've been hearing about something that's maybe along the lines of Lactaid, that's taken for lactose intolerance. Is there something like that coming that might be, in their future that they might be able to use?
In that 13-year-old's future, yes. There have been several medications that have been in the pipeline over the last 15 years or more. Unfortunately, none of them have reached market yet, but there are a couple medications. One is almost like the Lactaid, that you can go out to eat, but you still eat gluten-free, but you're not as concerned about the cross-contamination, so you can take the pill and go for it. So that is one of the things that's in the pipeline. It's not going to happen in the next 2 years, 3 years, but it'll happen in that 13-year-old's life. And then there's another medication that's sort of running along with this, is where you might actually be able to eat some gluten as well. And that's more of like an infusion, but it's there. So it's being worked on. Unfortunately, it takes time from the time that it starts in those clinical trials, and then it has to go through the FDA, it goes through the adults first, and then it goes into children. But as I said, the 13-year-old lifetime, there will be a medication.
So, Lindsay, before you go on, I would love Dr. Verma to talk a little about the importance of participating in clinical trials.
Yeah, so we all talk about, and I have 2 children with celiac disease as well, so I totally get it that we want a medication. I'll tell you what one of my kids, when I said to him that, what would you want if you had a medication? And at that time, and he was diagnosed several years ago, but at that time, the medication that was running sort of top gear was something like a Lactaid. And he said to me, I don't care about that, Mom. I want to eat gluten. I want to eat what others can eat. I don't want to go out there and ask, is this gluten-free or not? And that's a medication I want. And he said, and there's nothing else that you can tell me that can convince me that I want. I'm not dealing with it. I have my older child who, when I talk to her, she's like, I'm fine, whatever I can get, so I don't have to go through these questions all the time of, is this in the same fryer or not? Is the gluten-free pasta boiled in the same water or not? So I think we have different ideas of what we want, but how do we get to a stage where we can actually get a drug? So the pharmaceutical companies are all excited about the market, they're excited about the science, and they know that it will not be one medication that will fit everyone. But then once you start clinical trials, how do you take it to the next step? Patients have to volunteer. So we have to volunteer as patients. If we have celiac disease, sometimes they need controls that, may not have celiac disease. So if we don't volunteer, we'll never be able to move science forward, because you can work on the mice and you can work on rats and you can work on all that. But unless we get these drugs tried out on people, the FDA will never agree that suddenly I can write a prescription and people can have it, right? So if we want to have drugs for our children as they come around, we have to volunteer to join in. And again, all of these drugs and drug trials, there's a huge safety umbrella that's there. So people are not just going to throw drugs at you and, end up with severe side effects. So there is a safety umbrella, but we almost have to be the guinea pigs, if you want to call it, but it's really not a guinea pig. What you're trying to do is it's a short-term trial. For some of these drugs, you need to have actually a gluten exposure. And we know that if you have this gluten exposure for a short period of time, it's not going to affect you long-term. So we, as patients, need to follow up. We need to, first of all, find out which are the clinical trials that are there. Get to know, reach out to the centers, talk to the research coordinators, get all the information that you want to feel comfortable. And if you don't get the answers, ask to speak to someone else so that you can then find out, how do you volunteer for these things? What does it really mean? What's the end result? But if we don't do it, the drugs are not going anywhere. Nobody's going to approve a drug unless we volunteer to participate in these clinical trials.
Great. Okay. So another question here about, is there an increased cancer risk with the ingestion of gluten? So what this person is saying is they have some concern about repeatedly eating gluten-free food from restaurants that could be cross-contaminated. Is that increasing a risk for cancer over time?
If you continue to eat gluten, yes. But that doesn't mean that you can't go out to eat in restaurants. I think that again goes back to the education of the consumer and education of the restaurant. And in my opinion, I think people can go out and eat safe. You cannot go and eat at every restaurant, so you are restricted on that. But you can absolutely go out and eat. But yeah, I mean, if someone keeps eating gluten regularly, yes, you're at a higher risk for all the complications we talked about earlier. I don't know, Lindsay, is that the question or am I not getting?
No, that's right. That's right. And again, I think it just goes back to what you said earlier. None of this means don't go out, but if you're going out every day and you are ingesting gluten, that's definitely a higher risk. But please go out and eat and enjoy your life safely. And an occasional cross contact is okay.
And I think it's so important to emphasize on that because, hypervigilance is worse than anything else that we can talk about because there's such a burden of this disease on each one of us. And I think we have to sit back, look at things practically and say, okay, what is it that's going to be really bad? And what is it that I should relax about and not worry? And I think every time if you go out to eat and you are hyper worried about everything, then you're not enjoying that meal and neither is anyone else who's with you. So extremely important that you have your clinical team talk to them, let them help you, guide you through this. And then if you have a community, then people can talk to each other and say, I went to this restaurant, had a great experience. And then you go to that same restaurant and have a great experience. But extremely important that we learn to live in this world and go out and eat. If that's what makes you happy, then go out and eat. If you like to cook, then cook and be happy. Not me, but I prefer to go out and eat. And I think that we really need to relax about it. But that does not mean that you start eating gluten. And that does not mean that you don't question, but hypervigilance is not something that is going to be healthy for anyone.
Okay. If the original diagnosis was determined by a biopsy only, the labs were normal, what should be done to follow up in that situation?
So the serology was normal and the biopsies was suggestive of celiac?
It sounds like that's what they're saying.
Okay, so there is a small percentage of children where we call them seronegative celiac. In order to really make that diagnosis, you have to rule out other things. But if you're focusing in on celiac, so you have a negative panel, positive biopsy, you go on a gluten-free diet for 6 months, a year, whatever, and then you need to have another endoscopy done to make sure that those changes that were seen the first biopsy have improved and normalized on a gluten-free diet. And then you have to challenge with gluten. You absolutely have to challenge with gluten and then have another endoscopy done to see if the same changes occurred or not. Otherwise, you cannot call this seronegative celiac disease. So you have to have that series of things done. And there is a small percentage of people who have that. But there are other things. There's H. pylori, there's other immune deficiencies that can give you those changes in the small bowel as well. So if something does not follow the normal track of diagnosis, always have to double check before you go on a lifetime of gluten-free food.
Okay. Next question is, I think this is maybe more looking for some advice. We have somebody who tried to see a dietitian, but their insurance wouldn't cover it. Any suggestions for somebody in a situation like that, where maybe the insurance isn't helping them afford the dietitian?
I'm going to put Lori on the spot.
Oh, there we go.
I'll give you my answer, but Lori Wellstead, let's get you on the camera. So Lori is, as Rachel mentioned, our one of our dietitians. Putting you on the spot, Lori.
I'm sorry, I'm not camera ready right now, but yeah, I mean, I think unfortunately, if the insurance isn't covering it, we do try to write letters to also help. The physician could possibly also help to write a letter to see if it will be covered. It is very unfortunate because this is the only treatment is the diet. So even if you can see a registered dietitian for a one visit to even to get some clarity, there is some, valuable information online, but again, there's a lot of misinformation. So it's really ideal even to get a one-on-one with a dietitian, like I said, for one visit if possible. If you do have to pay out of pocket, again, like I said, it's not necessarily ideal, but it could be a good investment so you get some credible information.
Thanks, Lori. I think what Lori mentioned about writing the letters is sometimes helpful. And then sometimes the dietitians, if they have visits attached to a physician and do a medical code, that seems to cover the insurances as well.
Great. Okay. Another question is, this person is saying they'd like you to kind of review blood tests for celiac. What their understanding is that there's 2 genetic markers, and if you only have one, then it's inconclusive. Can you maybe talk through how that actually works?
So are we talking about the genetic blood test or the antibody test?
Well, they specifically said genetic markers. So,
okay. So traditionally the genetic markers that are checked for is called HLA DQ2 and DQ8. Not everyone has both. You can have DQ2.5, and that puts you at a risk for celiac disease. But if you have one or the other, you're at a risk for celiac disease. The higher risk is the DQ2.5, a double copy, but you still have a risk with DQ8. And as I mentioned earlier, there are others that are being investigated and found to be associated as well. But currently, DQ2 and DQ8 are the traditional HLA types that are checked. And it's a blood test. There are some cheek swabs that have been done in the past, and some places still do that. But it is a blood test. And specifically, if one is ordering it, it should say HLA DQ2 and HLA DQ8. Those are the tests that should be ordered if someone is ordering them. But please remember, you got to check with your insurance. This is not a cheap test to see whether your insurance covers the genetic testing or not. And there's a very few reasons currently that you want to know your genetics. So I would not pay the thousands of dollars for a genetic test. I don't think it makes or breaks a diagnosis.
Okay. Another question is, this person said, if there's no standard in blood testing here in the United States, and there's a definite wheat sensitivity, I guess what they're saying is that their son took a blood test in Hawaii and it was negative for celiac. They're wondering if they came to University of Chicago, is it possible that same blood work might bring different results? Again, going back to the conversation where there's not a standardized testing here. I think what they're saying is they feel like maybe there is celiac, but the last test didn't show it. Would it be possibly different if they came to University of Chicago for testing?
Well, I'd love to say that there's magic at the University of Chicago, but there is no magic. It depends on what that test was that was done. So there are different antibodies that are done. So whatever test was done in Hawaii, was it the correct antibody that was tested, and also how much gluten was the child eating? When I meant standardized is the assays, the kits are not the same throughout the country. And I don't think that if someone has an absolutely positive panel at the University of Chicago, it's going to be an absolutely negative one in Hawaii, if done on the same blood sample. However, if there's a low positive or something like that, potentially they could be different. So if you have a blood test done in Hawaii and it was the correct antibody done and it was negative and the child was eating a lot of gluten, perhaps at that time the child did not have evidence of celiac disease. Can that change over time? Absolutely. It's an autoimmune disease that gets triggered and can be triggered at any age. So if someone had a blood test done at 7 years of age and it was negative, and then they get another blood test done and they are 8 years of age and it's abnormal, it does not mean that that 7-year blood test was something wrong with it, just that at that time the autoimmune crisis hadn't occurred. So I think most important is to have the correct antibody checked and to have enough gluten in your diet. That's the important thing.
Okay.
If someone thinks that they truly have celiac disease, then you should see a gastroenterologist and have an endoscopy done. And, not just rely on a particular blood test.
Okay, we have one last question. It is coming from our 13-year-old friend again, and they would like to know if activated charcoal might help with the sickness as well.
So I was with you so far, my 13-year-old friend, but activated charcoal, no. Activated charcoal is not something that I would recommend. There are many people who use the activated charcoal, but I would not recommend activated charcoal for the vomiting. You don't want to aspirate activated charcoal.
Okay, now that's the last question. So we've gone through them all.
And I just want to give a shout out. I know we had Lori on, and Audrey Rowan is another one of our pediatric dietitians who's on with us this evening. And we are all part of the University of Chicago team. And I want to let you know that you can chat with our dietitians in a couple of weeks. Lindsay will send information, but we'll have a similar format to this evening, a free like a Q&A with Audrey and Lori, and we will focus more on the diet side of managing your celiac disease and talking to our dietitians. So we hope you can join us. And Lindsay, we have a few other upcoming events if you want to talk about those as well.
Yes, we have this Saturday, we have our Family Education Day. That is from 8:30 a.m. to 11:30 a.m. Central Time. And it's it's really geared toward the family. There's a lot of different topics that we'll be going through. We've got some presenters, we have some panels, talking about restaurants, talking about traveling with celiac, lots of different topics there, sort of touching on social, emotional, and all of the medical, obviously, all of the things. So that's on Saturday. And then on next Tuesday, we have an event called Spotlight on Men. And that is with, it's again, a kind of a Q&A setup like this. And we're going to have the gentlemen who run the Celiac Project podcast, and they're going to come and they're going to answer questions that maybe are a little bit more about men and men living with celiac and how it affects them. We're telling men, obviously, please come. If the men in your lives are dealing with celiac and you want to come to support them, please do that. Again, that's Tuesday, May 22nd, 6:30 Central, 6:30 p.m. Central. And then the one that Rachel was just talking about, that's the brunch with the dietitians with Lori and Audrey, who are on here. And that is May 30th, 11 a.m. Central. And again, it's a similar setup to this, a Q&A style, and you can bring all of your questions about food and what you can eat and what you can't eat and how to keep your nutrition in check and all of those great things. So that's our last event for Celiac Awareness Month. So we've got lots of things still coming.
Yes. And I really want to applaud Lindsay and give her the spotlight that is due. She has planned a beautiful month for Celiac Awareness Month. And I hope that not only these wonderful educational events, but we have our social media platforms where Lindsay has done a great job posting videos throughout the month and testimonials of people with their diagnosis stories. But most importantly, we want to hear from you and how we can meet your educational needs, your family's educational needs. We're always looking to introduce new types of programming. We're testing a lot of different things this month. But if you want to drop Lindsay a line or myself, we'd love to hear from you and just what time of day is best and what topics you're looking for. And we are here as a center to provide a lot of support to you and your families. We know celiac can be tough, but we are really hoping to help you along the way. We're with you in this journey together. And I just want to thank Lindsay and our team here at the Celiac Center, Rebecca, our student, who is always here tweeting and doing wonderful things, and Dr. Verma for your time and expertise. It is always such a pleasure to have you and share your knowledge. So thank you all. Lindsay, I don't know if you have anything else.
Yeah, I just wanted to say, I'll send a follow-up email to everybody that was registered for this event. There'll be a link on there so that you can go to the recording of it. You'll be able to find it if you want to reference back to any conversations that we had. There's a comment in the chat here. If you are in this call, I'll have your email. I'll send you that follow-up. And then that should also trigger you to get information about the events that I just was talking about. But what I'll do is I'll also include a flyer of our May, our events for Celiac Awareness Month for May. So I'll include a flyer. There'll be links right in that flyer that you can go and register for the other events. So it should all be in that email, but also you should receive emails from the center now that you've been on this call.
So thank you.
Yeah,
Yeah,
So
thanks, everybody.
I have a plug.
Yes, tell us.
So May is May, but throughout the year, we have events. So there's something where we have a family network events, and anyone and everyone is invited for that. But there is another event that is for those special teenagers. So we have a teen group that meets, and we really want all the teens to join us and be able to guide their journey. It's not for us, but the teens have to guide their own journey. It's all on Zoom. As I tell my patients, join us. And if you don't want to turn the camera on, don't turn it on. If you just want to say hello, you can say hello. If you have more to add, add that. But I'm really pleading to all the parents, please have your teens join, because this is what empowers them to do what they have to do for their disease for the rest of their lives. We are only helping a little bit, but they can tell us, this is what we want to look at. This is what we want to study. This is what we want to do. So please have them join and let them do a lot of things. There's a lot of fun stuff happening with the teens in that teen group. So please join. And I hope to see all those 13-year-olds, those twins, everyone else need to be there so that we can talk. And really, I think it's important for us as parents, grandparents, that we tell our children, get to know your disease, get involved. There's a lot of advocacy that they can do. They can bring this world more of the good gluten-free options that are out there, but also from a labeling standpoint, this is in your destiny, children, so join us.
Thank you. Thank you all. We hope you have a wonderful night, and we really appreciate you joining us this evening.
Thanks so much.